Hello everyone, today we're going to be talking about more on The Emperor of All Maladies by Siddhartha Mukherjee, and today we're going to be delving a little bit more into what Moria Cole discovered. You see, after her experiments on breast cancer with toxicolin, she thought, well, if they could work with stage 4 cancer patients, perhaps I could even work with perhaps it can even work better with earlier stages of cancer, like stage 2 cancer and so. Though though she did think about it, she never really implemented the idea. But who did was a guy named Paul Carbone. He decided to test he tried to test a few patients with cancer with chemotherapy right after they had surgery. But there's a problem. During that time, people still believe in House's method of radical surgery, and so believing it's the way to cure cancer. And thus, well, Carbone really had a hard time trying to convince surgeons to let him do his trial, because they just thought it was just humbug and that it would do nothing. And also, House thought of chemotherapists as like their arch rivals, always up to something not good. And so, shunned from them, Carbone decided to turn to someone else who was shunned from the surgeons. Another surgeon by name of Bernie Fisher. Carbone and Fisher decided to collaborate, trying to get a few patients in and test their methods to see if it's actually valid or not. And turns out it actually was valid. Well, for the few little patients that they were actually able to experiment on, they were not able to experiment on too many patients, unfortunately, because, like I said, Fisher was shunned from other surgeons, and he had a really hard time trying to convince other surgeons to help him out. So, enter stage right. Gianni Bonadonna, a visitor from another country who happened to be an oncologist. Good looking and all that stuff. He learned from the experienced veterans at the NCI, like DeVita, Canelos, and Carbone himself. Mainly on what chemotherapy is like and so. And in order to carry on their work, Bonadonna decided, work on, his own experiment, consisting of about 4,000 trial 4,000 test subjects that included many females that had breast cancer. And there were two groups. One that didn't have treatment and one that did. For the one that did not have treatment, about half of them had cancer relapse. The ones that did, 1/3 instead. And so, now that he has his data, he rushed into a medical meeting that happened, and that just so happened to, that is just about to adjourn. He literally burst through the doors and presented his data, and then everyone was just shocked silent with this new information and new discovery. It was like a massive breakthrough. And everyone thought that now if surgery and chemotherapy were combined, it would be pretty much unstoppable against cancer. Though that did do well, another thing was coming by, a dissentful voice, because doctors were only caring about saving the lives of their patients, not actually caring about them. And that's where a new radical chemical medical practice started, known as palliating, which is basically, well, palliate comes from the word palliare from Latin, which means to cloak. And their main purpose is to actually care for the patient, as if well they're a part of their own family or something like that, not just some random stranger they're trying to help. So, and the nurse that started this, well, she was treating a patient who was a Jewish refugee from Warsaw, and well, before he died, he gave her his life savings of €500, which is just to buy another window for her. And well, touched by this, she decided to make an organization dedicated to practicing this method of actually caring for their patients, especially if there is no hope. Considering during that time, doctors are usually like, well, we want to prevent death. We want to save the patient's lives. We don't want death. If the patient dies, so does our practice. So does our medical license. So does pretty much everything that we worked up onto this point. Well, the nurse argued that this shouldn't really be the case. It should be more of like, well, actually caring for the patient. And if you actually care for the patient, the patient will actually feel more welcome, and well, the experiments will be a bit more easier to conduct. And so, bonding with the patient can actually help with treating people with multiple diseases, including cancer. And this is where I end my reading.
Okay, so what did you learn mostly from all these things? What did you learn?
Well, that basically surgery and chemotherapy can actually be effective against cancer.
And it's a combination of both, you mean?
Yes, a combination of both. And then actually caring for the patient.
Bonding, yeah.
Mm-hmm. Yeah.
Okay, so what did you know that before or
not? The practice of actually trying to care for the patient.
Yeah.
No.
You need to care for the patient. You cannot know that. Yeah.
Yeah, I kind of know. Part of the Hippocratic Oath.
What about the other thing? What about the combination of chemotherapy plus surgery?
Oh yeah, it's a rather unorthodox idea, but brought up by a few scientists, like Carbone and Fisher and Bonadonna. Those surgeons at the time rejected those ideas at first because, well, they don't want to listen to those filthy chemotherapists. But eventually the ideas went through, and well, yeah.
Okay, so when you do surgery on chemotherapy, is there a specific order or?
A specific order, normally, yes. Basically, do surgery first, and then use chemotherapy to remove any possible remains of the cancer.
So if the cancer come back after you keep doing chemotherapy, or you how?
Not sure.
Okay. And so you do first a surgery to remove what?
The tumor.
To remove the tumor, but if there is some left, then that's why you use chemotherapy? It's a preventive option, the chemotherapy, to make sure they don't come back.
It's more of a preventive measure, yes.
Okay, thank you then.